All right, we're going to call this Finance Committee meeting to order. Present are council members Frazier, Cost, Labutus is in for Bub, Blake, and myself, Marmy. First item on the agenda is a resolution authorizing and directing the mayor of the city of Newark to enter into a housing revolving loan fund administrative agreement with the Ohio Development Services Agency and declaring an emergency.
Thank you, Mr. Chair. It's primarily a housekeeping item. We receive funds through the State Department of Development Services Agency into our department. We use those to do home improvement loans. And with those loans, when they become paid back, we call those revolving loan funds. Since we administer those revolving loan funds, we have to enter into an agreement with the Ohio Department of Service Agencies and renew the agreement. It's a 3-year agreement, and we're up for our 3 years. And Mr. Chair, it's got an emergency clause on it because they just sent me the email on December the 7th, and this goes into effect January 1st.
Okay, so does this need to be heard tonight? Is this one of them that's going to come tonight?
I believe it is, yes.
Okay.
I'll make a motion.
Motion by Frazier, second by Cost. Further questions and or discussion? Mr. Frazier.
If we don't approve it tonight, is it out of compliance or what's the ramification?
There's a grace period of the 12th of January, so...
There is a window.
Yes.
And then you just have to communicate back that it was approved, or is there something more formal that's...
There's the agreement. There's a signature page for the mayor, Dave Rhodes, to sign on. Okay. We email it back, and we're good. But even with the date of the 12th, we'd be struggling to get this done.
Okay.
Yeah, I'm just kind of looking here. Hold on, let me see. Okay. Yeah, this wasn't one of them that we had to bring forward with Rule 11 tonight, so it needs to be brought forward tonight with Rule 11?
Well, or we could bring it before January 7th. That'd be the first Monday in January. We could do it on January 7th and make their 12th grace period.
Okay.
Let's just plan on doing that.
All right, that's
okay.
All righty. Any further questions and or discussion? Seeing none, all those in favor signify by saying aye.
Aye.
Those opposed, same sign. The motion passes 5-0.
Thank you.
And with that, this Finance Committee meeting stands adjourned. Next up is Service.
All right, we'll call the Service Committee meeting to order. Those present are myself, Rath, Cost, Mr. Labutus, for Mr. Bub, Jeremy Blake, and Jonathan Lang. Let's see. Up first, we'll have a presentation by Dennis, and I apologize if I pronounce your name wrong. Kushan?
Perfect.
Thank you.
Yeah, I'm Dennis Kushan, president of Harm Reduction Ohio. We're a statewide organization based in Granville. However,
Hold on a second. Let me finish. So we all have a presentation by Dennis Kushan, who is president of Human Reduction Ohio, which he talked about.
Not human reduction. We're trying to trying to maximize the humans.
Harm Reduction Ohio. Thank you. Regarding starting a syringe exchange program in Newark. Okay.
That's correct. And Billy McCall, our director of syringe advocacy, is actually going to make our presentation.
Billy McCall?
Yes, sir. Are we good to start?
Absolutely. Go ahead.
Okay. I'll tell you a little bit about what we're doing here. We're trying to gain community support and starting and operating a syringe access program here in town. Yeah, we're trying to get a location, trying to secure a location. Yeah, we really like the main place, but haven't been able to get confirmation from the board. Yeah, let's see here. We'd like to have a location secured by mid-January when we go in front of the health board. State law requires that we have a location approved by the health board. We're also open to a mobile unit. We're also trying to create a culture of safe use and build relationships with people in the community that are using. So a lot of people ask why Newark, why a syringe exchange program in Newark, and I say Newark has always been, it's like the heart of Licking County, like, metaphorically and almost geographically as well. So we got a strong community, strong core values. We're somewhat progressive, I think, and we have really motivated leaders. So as a community, we need to face this issue with addiction head on. There's no one answer to the addiction problem. So, syringe exchange program is just another element to it. I spoke with Lisa Roberts in Portsmouth. She's actually won the Health Provider of the Year of some sort in Ohio, and she helped start the syringe exchange program down there. They currently serve 600 clients. They operate 3 to 4 hours a week, I think, on a Saturday. So I'd like to address some of the negativity that comes with syringe exchange programs. People say it's enabling drug use, and I can answer that a multitude of different ways. We think of it as prevention, not permission. There's been multiple studies, like multi-million-dollar studies by the U.S. government that says that found that syringe programs do not increase drug use. And I can assure you from a 10-year IV drug user that because I used a syringe exchange, that's not why I used. It actually helped keep me healthy, and that's what we're trying to do. Like, the path to recovery is many different ways, but when someone gets there, they shouldn't have to suffer from HIV, hepatitis C, infections and stuff like that. So also what we try to do, we try to address the stigma that comes with addiction, and by meeting with these people and offering them clean syringes and testing and stuff like that, we build relationships with them. And by building those relationships, when they do want treatment, they know who to come to. Kind of my passion about it is, I've been through treatment. I've contacted a lot of local treatment facilities and what we have here in the county, and there's little success I've had with them, waiting lists, things like that. I've been able to secure treatment for people same day out of a place in Columbus. This is, if someone decides they want to go to treatment, same day we can get them into detox. They can get them into residential treatment and their dual diagnosis. For mental health, stuff like that. So, that's a really big thing. And when someone comes to me, I have that resource, or I have that relationship built with them, by doing what we're doing here. So, there's a lot of benefits to it. The main thing is it's not a certain path to recovery. So I'm not shopping that to you, but it is a proven fact that it cuts HIV, it cuts hepatitis C and hepatitis B, which hepatitis B is at like an all-time high right now. We're pretty, I think, steady with the national average on Hep C, but that doesn't account the Hep C deaths, the people dying from Hep C, and the fact that it cuts life expectancy 15 years to somebody untreated Hep C. We'll also provide naloxone. We'll have naloxone on hand, which has personally saved my life. It saved a lot of people's close to me's life, and it would have saved a lot of people close to me's life if it would have been available. But it provides peer support. Nobody better understands a drug addict than a drug addict. And when we build these relationships, when they do decide to get into treatment, they know where to go, and they know that they can trust us, that we're not going to have them arrested or we're going to judge them. We also provide clean syringes and equipment. And like I said, create a culture of safe use. I think as a community, we've used drug addiction as an excuse for poor public health for too long. And Joe Evil's here tonight. I think he could attest to that. Also in the community, it's going to people think it's going to put more syringes in the community. Studies show that's not true. That there's not going to be syringes on every street. What also we're really concerned about is police accidental sticks. Like 70% of police officers will experience at least one accidental stick in their career. And of those 70%, 90 of them will experience two. And each time they're stuck, it's $6,000 in testing on the taxpayers. Okay? And that's not even if they got a disease from it. That's just for the testing. So we want to keep our officers safe. HIV, I know 2 months ago when I seen Trisha Pound, that particular day there was 2 new HIV cases in Licking County in Newark that she spoke with, and she was going to have them treated. It's $400,000 a year to treat one person for a year for HIV. So, if we could cut down on one of those 2, that would save the taxpayers $400,000. There's a lot of benefits to this, and what we're trying to do, we're trying to get the community support. And it's like I said, it's another angle to tackle this. It's not the answer. This isn't the answer to what's going on here, but it's a step in the right direction. It's another angle we can take from it. And yeah, I think that's really about all I got. Dennis, do you have anything you want to piggyback? Or?
No, but questions?
Yeah, if you have any questions, I'd love to answer them. Any concerns? Also, a lot of people seem to think that our clientele is going to be the homeless population. We estimate that maybe we do have a massive homeless issue here in Newark right now, and it's another thing that's going to have to be tackled from all angles. But we're estimating maybe 50% of our clients would actually be homeless. The other 50%, maybe some people in this room, people that work, people that have jobs and just don't have access to syringes. 8 months ago, I don't think it was such a big deal in Newark to have a syringe access program, but now that they're so unavailable, I've heard of people paying $50 for a used syringe, and I've heard of people picking them up off the ground, and it's horrible, And like I said, handing out clean syringes isn't all that we want to do. It's just part of keeping people safe and keeping them healthy to the point where they get to recovery. People ask, what about the people that are just going to use the program for the syringes? Well, that was me. When I went to Save Point in Columbus, I didn't care about any other service they offered but the syringes. But today I got 7 months clean. I own my own business. I'm standing in front of city council, lobbying for other addicts. People do change. People probably should have gave up on me a long time ago, but they didn't, and I'm here today. So I thank you guys for listening. If you have any questions, I'd love to answer them. We also have a website. Everything we do is science-based, compassion-based, and fact-based. And studies show that this stuff works. So thank you guys for letting us share.
Hold on a second, please. As chair, I'm going to exercise my right to ask a few questions first. And I do have a host of questions that I want to ask you. And anybody that's been here before knows I always ask a lot of questions, some of which I already know the answer to. But I'm just asking them because I think maybe there is some additional information that others need to hear as well. So I'm going to ask you a variety of questions and kind of play devil's advocate a little bit.
Yeah.
Don't take that as my attitude as for or against this program, but let me ask you a few questions. And I guess the first question I'm going to ask you is the syringes that you're handing out, what are they actually used for?
We assume drug use.
But I mean specifically what drugs?
I would guess to say that meth and heroin. We would probably do a survey and ask, what they use, and then gather that data. That's another thing. This program would be really good for gathering data. Mm-hmm. But yeah, I would say meth, heroin, cocaine.
Okay. All right. And the fact that you're handing out clean syringes, I know early on you said you focus on, you see this as prevention versus permission.
Yes.
So if you're handing out clean syringes, you're not really reducing the number of syringes that are out there. So how does that prevent accidental sticks? I don't understand the correlation between clean versus dirty and preventing accidental sticks.
We're talking about creating a culture of safe use where people have a value to the needle. We'll do exchanges. So now when you have a dirty syringe, you can exchange it for a clean syringe, So I think a lot of that's going to also have to do with something that we're not going to address here today, and that's, working on the laws with the syringe laws we have in town. If people are scared to go to jail or for whatever reason they're going to throw, I know I would throw a syringe out of a window of a car and throw it on the ground. I'm just saying that I thought you whispered something.
Yeah, I can explain it a little
Sure.
bit. It's harm reduction. It's not going to prevent it. It's going to lower its incidence. And if there is a stick, it's less likely to occur because it would be in a packaged needle that hasn't been put out. The ideal thing is for Newark to put in disposal locations so people can get rid of used syringes immediately. What we would do is give out containers for them to put them in. So it's not going to eliminate it entirely, but it should reduce it. One of the incentives now is, instead of doing it as litter, is to keep it on them as a person and bring it to them, bring it to the syringe program because it has value, and you get a sterile needle in exchange. So the reduction would be on them. They would have a greater proportion of sterile equipments, and if they followed our advice, they would package the used syringes in a safe container.
Okay, so if we have Sharps containers around town,
Yes.
for them to dispose of dirty needles, then how do they exchange that? Doesn't that defeat the purpose of exchanging a needle for a
If we followed best practices, it wouldn't be an exchange, it would be an access program. And we would ask them, how much are they using, and then give it, because yes, it's not ideal to have them carry it. They should just get rid of them immediately, as they do in Columbus, where they have exchanges, little boxes around the company. However, politically, the compromise that we make so that we don't give the perception that we're increasing the volume of syringes is to do it as an exchange. But best practices, the CDC does not recommend doing it that way. They recommend making it an access, and you give them as many sterile needles as they need, and we would like to do that. However, we're trying to address the perception that it's increasing the needles. We would like to do that, though, and I think if you would tell us to do it, we would definitely do it.
The prevention I spoke of was the communicable bloodborne, diseases. You know what I mean, with hepatitis C
Sure.
and HIV and stuff like that. Mm-hmm.
So you're talking about reducing the spread of HIV, Hep C, and Hep B.
Yes.
You're talking about reducing the spread amongst users for sharing needles.
Right. Yeah, Hep B can actually be transmitted through other ways, but yeah, and just because someone's using, like I said, they may use today.
Well, so could HIV and Hep C, but we're only talking about needles today.
Right. So, but with the Hep B,
Yeah.
Hep B can be passed through blood, and it can be passed through other ways. So I think the communities, we're all at risk for that. But just because someone, I think that question is kind of saying that because they're using drugs that they're not worth keeping healthy. Because people.
No, I'm not implying that in any way, shape, or form.
Okay. Yeah. I mean,
Not
yeah.
in any way, shape, or form.
Yeah, we're trying to keep, because when someone does want to go into recovery, or someone does want to change their life around, whatever it may happen, if we can help.
You also talked about that in association with the accidental pricks with the
Sure.
police officer, so we're talking about that as well.
Okay.
So I'm not implying that we need to not worry about spreading just because it's amongst users. I'm
Right.
not implying that at all.
I apologize.
Okay. So you mentioned several times studies show, but I haven't seen any studies. We don't have any of that here in front of us. What's your experience, whether either one of you answer this, or if Joe, if you want to come up and give us your opinion on this, what's your experience in the past as to how this has worked, and how long has this been? How long have communities been doing this?
Well, they started in 1980, so they're heavily studied. And I'd suggest that as you do Google CDC syringe programs, and a fact sheet will come up. But Joe, I would hope that he would say something. He made an excellent presentation to the Board of Health earlier this year, so he really is an expert on it. Joe?
Yeah, Joe, would you mind sharing with us your opinion or thoughts, or are you actually an expert on this?
As much as I am an expert at most things, I guess. This syringe exchanges in Ohio, the legislature approved those in 2015. They call them a bloodborne pathogen reduction program, because needle exchanges isn't as politically correct, I guess, to get a Republican legislature to pass it was certainly a challenge for them. And the fact is that they're designed to be a disease prevention tool. They really came into being around the HIV AIDS epidemic when it first came out in the 80s. And obviously, because those are bloodborne diseases, if you share a needle with someone, there's a high chance you're going to transmit it. You're, sticking a dirty needle, contaminated needle into your arm after someone had used it. The studies that CDC did mostly around that, that part of the program wasn't effective in controlling HIV outbreaks, and it certainly found that it was. So it was cost effective. Syringes cost about 15 cents a piece, so it's doesn't cost you a whole lot to do that, as opposed to, as you said, treating hepatitis, maybe $25,000 to do that. There's a lot of healthcare costs that are involved if you can prevent that. Down in Cincinnati, in the Kentucky area right there, they currently have a HIV outbreak that's associated with injection drug users. That I just saw the state just put out a $300,000 grant to help do all the track downs and things with those HIV cases. So the state's investing a lot of money in a kind of a response to it, as opposed to maybe what should have been more proactive. And that's all. That's kind of the argument here is, do we put something in place to try to prevent something which may not happen? Maybe we won't have an HIV outbreak here, or do you wait and roll the dice and see what happens, and then maybe by the time you find out, you've got a much bigger problem. But yeah, I think that as far as it being an effective recommendation, the CDC actually has a map of, of not just Ohio, but regionally, of where they consider at-risk counties, and where in those at-risk counties, they recommend that they should implement a syringe exchange. On the current map, we're a little bit north of it. It runs through Appalachia and some of the other areas along that, but that map's a few years old, so I'm guessing in reality that's probably, if they made a new map, we would be well within that, at what they would consider an at-risk area for a disease outbreak. And our hepatitis C rates, hepatitis damages your liver, and most of the time it's a long-term chronic exposure. You might not really know that there's liver damage until you're 10, 15 years down the road. And that, at least the cases that we're seeing, have tripled in the past 10 years in Licking County, and I think we've seen that statewide. So there's an awful lot of hepatitis C out there. Unfortunately, there's no vaccine for it, so there's treatments for it, but that's real expensive, and it's after the fact. Hepatitis B, we do have a vaccine for. Hopefully, children that were properly vaccinated, that were born in the 90s or later, should have immunity to hepatitis B. We're also seeing a hepatitis A outbreak statewide, which is actually related more to hygiene type of practices as opposed to bloodborne, but that also is really concentrating a lot in the homeless and in the injection drug use community. So there's a lot of other, besides just the overdoses, which is obviously what what we work on a lot with the naloxone distribution program and our fatality review that we do on every overdose death in the county. That's kind of on the far end of the spectrum, but there's a lot of other damage that's being done more slowly with the diseases that are associated, not just with infectious diseases with hepatitis and HIV issues, but also just an infection from using dirty equipment and causing a bloodborne infection, and especially ones that will affect the heart with endocarditis. And those can be, open heart surgery kind of problems sometimes to fix the damage that infection did once it kind of, got into the body. And those are, major issues when you get into those kinds of things.
Mm-hmm. Okay, thank you, I appreciate that.
Yeah.
Would you mind fielding some questions while you're here?
Sure.
Since you're here? Okay. I don't mean right now, I just meant if somebody else has any. I really don't have any questions. Mr. Costa, I know you did.
The gentleman that was speaking,
Yes.
when a user comes to get a clean needle, and you would do this exchange, are you looking at this as being in any sort of a medical setting whatsoever? Is this exchange with the idea of leading towards prevention or leaning towards recovery in the delivery? In doing this exchange, is that something that
Ideally, we'd like to be in a medically set environment. We'd like to be able to do testing, for Hep C, HIV, stuff like that. And ideally to me, it's another road to recovery. So,
because I'm going to be honest with you, I wrestle with the phrase safe use. When somebody is injecting whatever drug it is into their body with a needle, whether it's meth or heroin or whatever, the phrase safe use doesn't exactly ring well with me. And I'm also surprised to hear that a new needle, a clean needle, is 15 cents. I have no idea what it costs to buy meth or heroin. I have not the slightest clue.
Right.
But I can't imagine that the 15-cent needle is a huge factor, as opposed to using a dirty one and the chance of your disease, your life, the infectious. I kind of struggle with some of that. To be honest.
Absolutely, and it is a huge factor. Up until 8 months ago, you could walk as a drug user. You could walk into Walmart on both locations and buy syringes. Since then, they've stopped doing that. So there's nowhere you can actually access syringes. It's not most drug addicts have no problem spending the money to buy the needle to have a clean syringe. Like if you look at a syringe that's ruptured the skin one time under a microscope, it looks like a fish hook. At naked eye, it looks fine. But under a microscope, it looks like a fish hook just because, penetrating through skin. So, we're harm reduction.
Why are these stores not selling them anymore?
I don't know. I don't know if there's been some push from the local authorities. I don't know. And they had sold them for, 15, since as long as I can remember. You could walk in there for $1.26 and buy a 10-pack or $12 and buy 100, but now you can't. And since then, it's became a really, really big issue around here with the syringes. So,
Under Ohio law, it's pharmacist's discretion. So it's up to the pharmacist and the policy, and it would be enormously beneficial if people could just buy them, and it would really diminish the need for a syringe program. But it's kind of a workaround of that law.
So are these needles comparable to what you would use as a diabetic?
yeah.
Okay.
And diabetics actually come to to syringe exchanges because it's not just for drug users, it's really for anyone who needs it. So like at Safe Point, you'll have 2 or 3 diabetics a day.
Did you have any more questions, Mr. Klaus?
So you're saying that a diabetic cannot go and buy syringes for their...
A diabetic can because the physician will view that diabetic favorably and, but they'll look at Billy in his old days and say no, is what it comes down to. Like if I went in, I could say it's for my insulin for my cat. I'm from Granville, no one's going to think that there's anything wrong with that.
Yeah.
But if Billy in his old days goes in,
There aren't any heroin
it's an
users in
example of
Granville?
stigma though.
I guess not. And please understand, the questions are sincere, wanting to understand.
Oh, absolutely.
I don't claim to understand. Thank you.
You're welcome.
Mr. Lang?
Yeah, Billy, I guess first I'd just like to say congrats here on your time clean. I think you're doing some great work in the community.
Thank you.
And so I'd just like to say good job on that.
I really appreciate that. Thank you.
Couple of questions. So we were just talking before about the loss of access at Walmart and Walgreens and pharmacies locally. Do you know where users are currently getting needles? Where are they coming in? How are they coming into our community today?
I think probably some people are using Safe Point in Columbus. The ones that can't make that commute, you can order them online if you have an address and a credit card to have them sent. So I know that a lot of people are using old needles. You know what I mean? So,
Sure.
I'm a little bit out of the loop now, but yeah.
It's not a bad thing.
Yeah, no, absolutely not. No. And a lot of people ask me that. If you're clean now, why would you care about getting syringes into people who use his hands? And I said, because if maybe someone would have helped get some clean syringes in my hands, I wouldn't have hepatitis today. Now that I'm clean and living my life, I wouldn't have to, clean up so many messes that I made for myself, And if that's one that we can prevent for somebody, I'm all for it.
Sure. So, what's the community cost? What does the harm reduction? What do you need from city council, from the city? What are you looking for specifically from us?
We'll take money if you're offering, but we're gonna fundraise it ourselves. And the real name for needle exchanges are syringe service programs, and depends how much service you offer drives up the cost. Like a full medical model, like in Cleveland, they have it's done by Circle Health. And in Hamilton County, the health department does it with a huge van, and those programs cost like $400,000, $500,000 a year. But there are 19 of the 88 counties in Ohio now have these programs. Muskegon has one, Columbus. So you can do it on a low budget. Like we can put them in our car and do it on that. We would like to sort of be at a higher end. We're looking at sort of like 40 or 50,000 a year. But it can go down and it can go up.
Is there support or anything you need specifically from the city to move forward, or is this more just about raising awareness now, kind of getting the message out to the community?
The law requires that you consult stakeholders. So we had a big education forum at the Newark Library that was well attended. Joe has talked to law enforcement and others. We've talked to the hospital. So we're really here to, and we talked to David Rhodes, Dave, if he's here somewhere, about the city's concern. So we're specifically here, like when we talked to Dave, he was concerned about the square. And we don't want, we already have a homeless issue. Why does it have to be focused in Newark, downtown? So we want to take that into account and get your thoughts on location. We're looking at, we would like to do it, we haven't got approval yet, at the main place on Saturday from 9 to 12, which is on the other side of the tracks, and it's not quite on the square. Like, we don't want to do it on the square because we don't want to conflict with what the city is trying to do. However, we do want to prevent people from getting hepatitis C and HIV and have an opportunity to go into treatment. So it's a trade-off. And like if you wanted to tell us a location and help us get a location, it's something that we would appreciate.
So because the state legislation has already been passed through, you really don't need legislative support through us.
That's correct. Unless we were going to a place that wasn't zoned that way. But I think every place we've looked at doesn't have a zoning issue. Correct. You have no legal authority to stop us,
but at the same time, anything that gets done in this community, it gets done with like full support. You know what I mean? So, and if we go behind people's backs and we try to do this and that, we just really want the community on board with this in all aspects: law enforcement, healthcare providers, the judicial system, everyone. So
we want to be part of the community.
Yeah. And we want to bring these, people that are using back into the community. So, I mean,
appreciate it. I did have a quick follow-up question for Joe. Just want to make clear. So, is the Lincoln County Health Department in favor of doing a syringe exchange?
Well, ultimately, the way the law is written, the Board of Health has to vote to authorize the syringe exchange, and they haven't voted on that yet. And they're kind of like you guys, they're representatives from the community, so they have, I'm sure, a lot of the same concerns that anyone else would have. So they, they're not gung-ho for it. I think they're waiting. Part of that process is getting feedback from those entities, the city that it's in, find out from their officials, the addiction community, law enforcement, healthcare. There's a whole bunch of stakeholders to try to get feedback from, but ultimately it'll be the Board of Health that then has to decide if they present a plan on what they want to do, whether they'll authorize it at all. So that's kind of an unknown at this point, but certainly I think if the city is strongly opposing it, that's going to carry a lot of weight with the Board of Health, certainly.
Sure. Just one last question. You mentioned the numbers on Hep C, Hep B. In terms of the numbers you've looked at, are those related to intravenous drug use, or what's your take on the causes of the increases we've seen over the last 10 years?
Well, I don't think we have good information on how hepatitis C is getting acquired, because a lot of times they're old cases that are just now getting found because the recommendation for testing, like for baby boomers, that's relatively new, and there's a lot more testing going on. We're just now starting to test again at the health department and our STD clinic. Mm-hmm. So, according to what CDC has said, some of it at least is attributed to the heroin epidemic, and hepatitis B again is bloodborne. We have a lot less cases of that than we do hepatitis C, and because we're a smaller county, the numbers kind of jump around. Right. But if you looked at over the last 10 years, it also has about tripled in cases. So, we do have a lot of concerns about that. The most data we have on actual transmission is the state tracks all HIV cases, and they, as part of that investigation, they ask them, are you a man who has sex with men? Do you use injection drugs? Do you do all these different things? And I think up until about a year ago, it was maybe 9% of women that contract HIV got it or reported injection drug use. Maybe I think it was 7% of men. But the latest number is that they're talking about those numbers have jumped up quite a bit. So we do know that that is at least a fairly serious and growing part of that disease transmission.
Thank you. Thank you, Joe.
Mr. Blake.
Thank you, Mr. Chairman. First, I just want to say that from the work, from what you have done already, Joe, with the Board of Health, from the naloxone training, and that's a form of harm reduction, correct? And so when we say harm reduction, we shouldn't just immediately think of the syringe exchange. I mean, there's other forms of harm reduction, and the naloxone distribution is a part of that, correct? And we've been doing that. How long has the Board of Health been doing that?
2 or 3 years.
2 or 3 years, okay. So that's because for many times, I mean, an argument was, well, why are we doing that? Why are we saving, people that are using drugs? And I mean, the same argument that we're hearing about the syringe exchange was said many years ago, just because there's certain stigmas attached to different things that people just don't know. I mean, we're here in a public meeting trying to educate people, and people sitting in this room are at different levels of understanding. And so, I appreciate you guys coming in tonight to educate the public. I mean, that's really a part of this, is to educate people on what harm reduction really is and trying to save lives, and then also, just trying to bring an awareness about the programs and the scientific. I mean, the argument for these things is that you really do save lives. I mean, that's correct, right?
Yeah, Cincinnati just had a report where they've cut their overdose deaths in half, and they attributed a lot of that to their naloxone program that they have. Dayton, Montgomery County, in the last year, their overdose deaths are cut by 50%. They have very comprehensive programs, that kind of would put us to shame, but they're, certainly naloxone's part of that. But, I think it's one of those where, there really isn't a magic bullet on that to try to address the issue, and you have to work around a number of things. Fentanyl test strips. At one of the big concerts this summer, there was a guy testing drugs for people to make sure they didn't have fentanyl in them when they thought they were buying something else, and it was, had been cut with that, which a lot of times is what's causing the severe overdoses. So with naloxone, we actually saw the overdose rates start to drop in Licking County, but then they came back up, I think, because fentanyl, the synthetic opioids came in. And, I wouldn't want to think what it would look like if we hadn't gotten naloxone out a little bit ahead of that, with the risk of overdose with those fentanyl and carfentanil.
And it's my understanding that the Community Mental Health Recovery Board has gathered a harm reduction committee to start thinking of how our community altogether, either be the fentanyl strips or the naloxone or the exchange program that we're considering. This committee meets tomorrow, I believe, and so I know that discussions are going to be going there with Case Burgle and others at that level as well. So within social services and within the medical community, I mean, this type of program is highly favored. Is that?
Yeah, I think that, mental health recovery is obviously looking at just harm reduction in general, so we'll see how that, where that group goes. I think the general idea is that everybody wants to get people into treatment and recovery. That's obviously the end game that in a perfect world, but the reality of it is you have to kind of meet people where they are. Some people aren't ready for that step, but you can, at least try to mitigate the damage that's being done and then build relationships so that when they are ready, you're able, they know that they can come to you, and also then have that provider network where, if you're ready, we can get you in today. Because if you're a heroin addict, you might be ready now, but if you say, I come back in 3 days, you're not going to go 3 days without using heroin again, and you may have changed your mind by that point. So there's a lot of moving pieces to try to really deal with the problem.
Well, I appreciate all the work and advocacy that you do. I'm curious if Dennis could come back up. Dennis, I know Billy kind of jumped into the discussion real quick, but can you give us a little background on your organization and how you came to Licking County and where all that fit in and how you became sort of passionate about this issue?
I was a national reporter at USA Today for 30 years and took a buyout and thought, what can I do to make the world a better place? And there was death all around me. So I'd known from being a reporter that harm reduction saves lives, and there was no harm reduction statewide organization in Ohio, so I formed it in my office above the River Road Coffee Shop, and we've grown since then. And I thought Councilmember Koss put his finger right on an important point, is that it's not about safe drug use, it's about safer drug use, because it's really about risk management. And where harm reduction differs from sort of other philosophies is it's not an either or. In harm reduction we say any positive change, incremental change. What can we do today to help you be safer tomorrow? And if you are still going to use, we still care about you, and we're still going to try to make you healthier and safer, so that eventually when you build the trust, you'll see in the CDC fact sheet that people who go to harm reduction are 5 times as likely to go into treatment. And you have to ask yourself, why? Because we're not pitching it every day. Is because Billy will tell you they've already heard it. And what it is just trust, love, and compassion. So when they feel it's time, where do they go? They come to us, they come to Billy, and that's where it happens.
Mr. Blake, did you have any questions?
Yeah, I do have additional questions. Thank you. When you had discussions with the main place about the location for this possibility, the directors were in favor of that. Is that correct? Or?
Yes.
Okay. All right. And the main place is in the South End, which is a neighborhood I represent, and I know that we have St. Vincent's in the South End, and the vertical 186 is in the South End. The main place is right there on South 3rd Street. So anything I could do to be supportive of your efforts, please let me know.
I appreciate
that. The stigma attached with mental health issues and attacked with drug addiction is something that we need to battle together. So I hope that we can work together to do that.
I appreciate that.
Okay. Did anybody from the audience have any questions or comments that they wanted? You could come up, and this goes not just to him, but to anybody in the audience. If you are going to make a statement or make a question, please come up to the podium, state your name and your address for the record, and then your question, please. And then
Stephen Smith, 237 Violet Court.
I'm sorry.
I'm sorry, Stephen Smith, 237 Violet Court, Newark. I'm not associated with this organization. I just want to comment. In the early 80s, I had some severe health problems, required multiple blood transfusions. and I did contract hepatitis C at that point. That was early enough that they were still calling it non-A, non-B hepatitis. The good news is that I have had treatment for it, and I'm basically totally in remission at this point. The comment is the human cost of this. The treatment spent a total of 1.5 years and 2 sessions of getting interferon injections, which is sort of like having a 1.5 year long case of the flu. And I tolerated it well. I know of people that were not able to tolerate interferon and had to stop it because the treatment was worse than the disease. And it's extremely expensive. And every person out there that has hepatitis C is another opportunity to transmit it to someone else. So I would like to encourage the board the council to support this activity, just for the human cost and the economic costs of not having to treat people with this very expensive, very debilitating sort of treatment, or else have to suffer the consequences of the disease.
Thank you. And glad to hear that you're doing well. Mr. Frazier.
Mark Frazier, 20 West North Street, Newark, Ohio. Billy, I have a couple of questions for you. Sure. So, when it comes to what you're proposing, is it needle in, needle out? Is that what you're proposing for your exchange, or is it give? If you don't have a needle, what?
Ideally, it would just be a syringe access program, but
Billy, could you come a little bit closer?
Sorry.
Just the microphone needs to be able to pick up the conversation.
Ideally, it would be a syringe access program where you could just access clean syringes. But we're willing to meet a compromise for 1-for-1, and that creates, like I said, it creates a culture of safe use, and people are going to start trading them in. They're going to hold on to them for more value. So.
And then the other question is safe use facility. So you're not proposing that your facilities where they're also going to use the drugs that they get as well?
No,
right?
sir.
And then the other question involves the San Francisco exchange and the Seattle exchanges. And so what we've seen is a lot of open air drug use and kind of networking in those exchanges for drugs. So is there protections that you can put in place to not exacerbate the situation and get them into recovery?
I know SafePoint, they use is it ununiformed? He's an ununiformed?
It's a uniform.
Actually, a uniformed officer there for the 3 hours that they operate, and they don't have any issues with people using outside or whatever. Typically, people want to get their stuff and go home, especially in a town as small as Newark. It's small enough where everybody knows you, and big enough where we have the resources to put you in jail. So it's going to be a quick type deal. And like I said, my end of it, my passion of it is I'm working with a lot of different facilities all over the state, not just in the county, but all around the state. And we've been able to secure a treatment place with 3 different facilities that can do anything from medically assisted treatment to get someone back on their mental health meds to detox today, which is like almost a miracle. Like, these are really good things, and obviously I'm not going to be pushing these on people, because I know when I was using, I had heard it all, I knew it, but when it was time to get help, there's just a small window, you know what I mean? And if I could have went that day, it's what it has to be. It has to be a right now type thing. A lot of things can happen over 2 to 3 days, or 2 to 3 weeks, or 30 days, or you could die. So I mean, that's the reality of it.
Congratulations on your recovery.
Thank you, I appreciate it.
The good work. Thank you.
Thank you.
Anybody else from the audience? Okay, well, Dennis and Billy and Joe, actually, wherever Joe went, there he is. Thank you very much for coming today. Billy, congratulations on the recovery, and I hope you stick with it and stay on a good path. And it's great to see that you're doing good things, and you're passionate about helping other people. I appreciate that. So if there are no other questions, no other comments, we will complete this topic and move on to our next.
Thank you, guys.
Thank you. All right. We'll pause for about 30 seconds, give people an opportunity to walk out. All right, our next issue up is resolution number 18-100, a resolution authorizing the Director of Public Service to execute a contract for reimbursement of legal representation of indigent persons for calendar year 2019 with Licking County Board of Commissioners for the City of Newark, Licking County, Ohio, and declaring an emergency. Mr. Sassen.
Thank you, Mr. Chairman. This is our annual legislation to allow the city and the municipal court to be reimbursed for attorney fees for indigent criminal defendants. The reason for the emergency is the narrow window between the time the paperwork is received through the Commissioner's office from the state of Ohio and the time that it has to be returned in order to secure that financing.
Thank you. Any questions from the committee? Questions from the audience? Mr. Frazier. Quickly to the podium, please. Quickly to the podium, please.
Mark Frazier, 20 West North Street, Newark, Ohio. Does this have to be voted on tonight because of the December 31st deadline?
No.
Okay.
It has to be passed as an emergency, but I don't believe it has to be passed tonight. I understand.
Okay.
Any other questions? Anybody like to make a motion?
So moved.
Motion by Lang, seconded by Cost. Any further questions from the committee? Seeing none, all those in favor of passing this on to council signify by saying aye. Aye. Opposed, same sign. That passes 5-0. Thank you, Mr. Sassen. Up next, consider resolution number 18-103, a resolution appropriating the real estate known as parcel number 054-191-250-00.00, Newark, Licking County, located at 519 Arlington Avenue, Newark, Licking County, Ohio, authorizing the Director of Law to proceed with a complaint for appropriation in the Licking County Court of Common Pleas and declaring an emergency. Mr. Moorhead.
Yes, these next two pieces of legislation are from our state Safe Routes to School project on Arlington Avenue that we discussed a couple of weeks ago. You had the resolution of intent before you for both of those properties, like I said, a couple of weeks ago. So this is the actual ordinance to appropriate the property. And these are for temporary easements for grading back the area behind the new sidewalk.
In which the property owners are being paid fair market value for?
The appraised values are $300 and $400 for the temporary easements.
Okay. Any questions from the committee?
Motion.
We have a motion by Lang. Second by Labutus. Any questions from the committee? Questions from the audience? Seeing none, all those in favor of passing this on to council signify by saying aye.
Aye.
Opposed, same sign. That'll pass 5-0. Thank you. Next, resolution number 18-104, resolution appropriating the real estate known as parcel number 054-1922-3400.00, Newark, Licking County, located at 443 Arlington Avenue, Newark, Licking County, Ohio, authorizing the Director of Law to proceed with a complaint for appropriating the Licking County Court of Common Pleas and declaring an emergency. Mr. Moorhead, would you like to say ditto?
Same story, yes, sir.
Okay.
Motion.
Motion by Lang, seconded by Cost. Any questions from the committee? Any questions from the audience? Seeing none, all those in favor of passing this on to council signify by saying aye. Aye. Opposed, same sign. That will move on to council. We'll go to 5-0.
Thank you.
Well, that was quick. And that concludes the service committee. We will stand adjourned. City council will reconvene in approximately 18 minutes at 7 o'clock. Thank you.